I can see you, but you're not coming in. I can't really see you well enough to look at your rash there. No, no, don't hit the camera. Let's try something else.
All right, Doc. I don't know how this stuff works. It was a lot easier when we had just the phone, so at least we could hear each other.
Yeah.
Let's pretend we're on the phone, you know. So anyway, if you saw this rash, it's kind of, and it's really itches.
No, I really need to see the rash to make an assessment. So, you know, I know you really wanted to have this virtual visit and you requested it, but there's really not a good way for me to visualize the rash right now through this. So I'll have to see what. I'm going to have to see you in the office. You know, I'll have one of my admins give you a call and we'll set up a time that works for you. And then we'll get.
All right. I will. Yeah, I'll make an appointment then.
I think the biggest issue that doctors face with deciding about whether a telemedicine visit is appropriate or not is the physical exam. That's the thing everybody is talking about now. How do you do a physical exam remotely? And it's certainly a valid question, but it also depends on, again, who the doctor is and what kind of exam they need to do.
Many institutions have organized already at this point ways to triage visits to virtual or to in-person visits. And the things to consider are, is this the kind of condition where you are going to actually need to be doing more palpation, for example, to make a diagnosis? Is this a patient for whom you need to be able to actually yourself accurately measure their blood pressure or look at them head to toe? Because the adequacy of the video may not be enough for that particular patient based on your past experience with them. So I think that as we get more experience with this technology and the limitations and benefits of this technology for virtual delivery of virtual care, it will become clearer which visits should be triaged to virtual versus in-person.
I think that virtual gives us yet another weapon in the arsenal to make sure that we get the job done. And so sometimes a phone call is not good enough to go through a tricky test result, and yet a full office visit isn't required. Perfect solution for virtual care. If you need to show somebody an image, I'm a neurologist. I frequently have my patients undergo MRIs or CAT scans, and I want to show them a finding and explain whether it's serious or benign and what the treatment will be. Being able to do a virtual visit and share the image is so much more valuable and potent.
The thing we really worry about most is missing a diagnosis. And the reason we say that is we know in the malpractice world, the few lawsuits we've seen around telemedicine, many of them, 3/4 of them have been about diagnostic errors, something that we worry about even in in-person visits. So I think that's something to keep in mind. And I think for doctors, their sort of antenna has to be up. And if something doesn't feel right, I often say to physicians, we have, especially doctors that have been in practice for a while, we have a sixth sense about things. Don't ignore that.
One of the basic principles of doing a visit virtually is that you shouldn't be compromising your diagnostic decision-making because it's a virtual visit. And if you don't have enough information to make the diagnosis, the patient should be seen. And I think that basic principle is that this is a piece of technology that you're using, but it's still a patient doctor or patient advanced practice practitioner encounter. And it should be thought of as that both by the clinician and by the patient and family.
So some things are readily transferable and other things are really tricky to assess, like the tone of a muscle. It's a very tactile thing. You really can't test that without holding the limb yourself. You can get some indirect indicators, but as a provider, as a clinician, you need to know when is it time that you have to see someone in person.
There are many things that have been pointed out to me by clinicians that they worry about when it comes to remote visits. Many doctors say there are patients who come to see them for one thing, And then during the course of a history and physical, something else comes up that they wouldn't have expected, that you might not be able to do when you're doing something remotely. Some of these things you can, but some you can't. Now, there's really no way to predict that, but I think it does place the onus on a physician when they're seeing a patient remotely to make sure they do a very good history, asking patients for things that maybe they wouldn't have otherwise.
I think that good practice in virtual care is just like good practice in in-person care, but it takes some extra attention. So you have to make sure you've gotten what you need from the patient in terms of information or physical exam. You have to make sure the patient has understood the instructions, understands the next steps, because it's easier to miss that when you're over video. It's harder to read some of the finer social cues. You can't always tell what the person off camera is thinking next to the patient because they're often present in the room but not on the screen. So you need to be more deliberate and more intentional. And I think our biggest risk is that we miss something and we don't have the usual social and behavioral cues to alert us to that in the virtual environment.
In terms of website matter, it's a good idea to look at your background to see are you in a private place? Are you sitting yourself as a clinician in a place where it looks uncluttered and clean and well lit, and you're wearing clothes that are appropriate for delivering this kind of care on a virtual platform? Those are the most important things, that you have good line of sight, you have good audio, that you are making contact with the patient by looking at your camera, that if you need to look down or you need to look at another screen to get the notes that you're explaining to the patient, what are you looking at? And that you're talking your way and narrating your way through what you're doing with the patient.
We know that so much of how we communicate as human beings, 80% of how we communicate is not what we say. It's everything around it. It's our hand motions. It's our eye expressions. And when you're on a screen, these become magnified. So it actually, I would suggest that for physicians who are thinking about really incorporating telemedicine into their workflow, into their practice, that it's worth paying attention to these things. And there's some great guidelines from some national organizations about how to do this well, how to show empathy in a video.
If you're flustered, you have to be extra careful because that can create cognitive overload and actually diminish your skill at practicing the art of medicine. So the technology should be transparent and it should not be in the way. You shouldn't even know that it's there. If you know that it's there and it's getting in the way, think again. Maybe you need another visit. Maybe you need a longer visit. Maybe you need to switch to the phone. But don't just tough your way through it and then kind of move on to the next case. You really have to solve each problem in the context of the visit.
And if you're doing a remote visit and you feel like something doesn't feel right, then don't be afraid to say to the patient, I really need to see you in person, or you need to see a doctor in an emergency room if you're not close to them, or see somebody soon. And I don't think we should be worried about doing that. And in fact, I think patients will appreciate that even more if we've started a remote exam because the patient desires to do it that way. And then we tell them, look, I was happy to do this, but now I really feel uncomfortable with the things you've presented to me and what I'm seeing and hearing from you. And I really need to see you in person. And I think that might make patients even more likely to do an in-person exam when they might have not done that otherwise.
You can do an awful lot of the exam virtually and then have the patient come in for a very brief follow-up, maybe after some test results, and complete your physical exam then. So you have to deconstruct the in-person visit, reassemble it in the virtual world, but remember the pieces that you put aside so you can pick them up when you see the patient in person if necessary.
One of the workflows that needs to be carefully considered with a virtual visit is that when the visit is complete, what are the next steps for the patient or family? When a patient was in your office, they likely would walk out of your exam room and stop at the front desk and maybe be handed a visit summary or also some written instructions about medication changes, about follow-up tests. And now that is all being done virtually. So it's important to understand, how is the follow-up happening with the patient? Is there a visit summary being posted to the patient's portal? Is the visit summary being mailed to the patient's home? How will that patient know about new medication or prescriptions? Has that loop been closed? If there's a recommendation for a follow-up test, is there someone at your back office who's going to be checking to ensure that that the patient understood about that follow-up test? So all of these aspects of closing the visit are a point of vulnerability for patients.
Ironically, we think as providers that our, healing touch and our presence outweighs every other consideration in the value chain that patients experience in healthcare. But many of my patients tell me that if they come see me in the office for a half an hour, it might be 4 or 5 hours start to finish before they're back home again. And only a tiny portion of that visit was spent with me. Over video, in 35 minutes, they spend 30 minutes with me. So there is an intrinsic value for patients because we have removed many of the other necessary preamble to a visit that can make the experience really joyful for patients and really convenient and really there when they need it. So I think it has a lot to offer, but it's not a panacea, and it shouldn't be the only way we interact with patients. It should be complementary to in-person care, and we should use the vehicle most suited to address the medical problem in the most convenient, patient-centered, and cost-effective way.